Hello and welcome to YouTube channel HealthQ, the place where our mission is not only to motivate you but help you to move on to the brighter side of the health. In today's video, let's talk about piriformis syndrome, a very common problem which gets sometimes mimicked as sciatic pain for a lot of people. There are a lot of people who feel that if the pain is happening in the back and if the pain is going down to the leg, then it is a sciatica. Sometimes it's not, sometimes it's just piriformis syndrome. So what exactly is piriformis syndrome and what are the ways with which you can bring this piriformis syndrome under control? We are going to discuss that in today's video. So make sure to watch this video till the end. Let's begin. So friends, piriformis is basically one muscle which surrounds your hip joint, you can say. So basically it starts from your back and crosses the hip region and inserts there. Now from there is a small opening from where your sciatic nerve passes, and whenever this muscle is tight or else injured, it compresses the sciatic nerve, and that's why it gives sciatica like symptoms. So that's what is piriformis muscle. Now whenever there is a shortening, tightening, weakness, inflammation or else compression on this muscle or else on the nerve at that region, at that time we would be calling it as piriformis syndrome. Now the most commonest sign of a piriformis syndrome is pain in the low back and one side of the low back region. That's the most commonest presentation that you will start observing or experiencing, and then gradually as the problem will increase, the patient or else the person will observe that pain starts moving down to the leg over the thigh region. Mostly this area is on the back and the outer side of the thigh and not in the front of the thigh. That's where we can identify that it looks like piriformis syndrome. Still we cannot confirm it is piriformis syndrome until unless we rule out other conditions as well. Back problem are very massive. Like back problem can happen due to many reasons, and that's why it's very important to identify the root cause of it. Piriformis syndrome is just one such condition that could lead to back pain. So it's very much possible that you as an individual can get confused between a lot of conditions. So make sure to see a physiotherapist without just coming up with your own convention or your own conclusion about what is my problem. So having said that, piriformis syndrome will lead to pain on the lower back, which will be more on one side, and then it will be moving back. Similarly, the pain is also felt in the back and the outer thigh region. And there is a typical tenderness or else pain which is felt on pressure on the gluteal or else on the outer side of your hip region, and that's where there is a chance of piriformis syndrome. Now what should be done in order to reduce the symptoms? So whenever you will go to a doctor or else a physiotherapist, they will take your examination, they will take your history, and they might ask you for some blood test as well as some X-ray, CT scan, MRI to identify the root cause of it. Once it's clear that it is piriformis syndrome, that's where the treatment comes into the picture. Now, after doing all the gyan, let's start with what are the fastest way with which you can reduce your piriformis syndrome. Now, most of the time piriformis syndrome can happen due to an injury or else an inflammation where there would be an acute severe pain. So whenever there is an acute severe pain, the first thing that you can do is apply ice pack to that area. Take a simple ice pack, or simply take a water bottle, fill that with normal water, keep it in freezer, and then place it over the area where it is hurting you. Apart from that, if you have ice cubes, you can just pull together all the ice cubes, put it in a cloth, wrap it out, and then you can just massage it to that area. Ice pack reduces inflammation and thus helps in achieving pain relief. If your pain is chronic, similarly you can do hot fermentation instead of cold pack. The second thing that you need to do in order to get immediate or faster recovery from your piriformis syndrome is to take ultrasound therapy. Ultrasound is a machine that we physiotherapists use where we combine your normal ECG gel with a Volini gel. When these two things mix and when there is a circular massage which is done on the piriformis region, that gel will be penetrating very deep over the tissues and will help in reducing the inflammation level. At the same time, you can take TENS therapy for a brief period of time so that your body get acquainted to that sensation of discomfort, and slowly your tolerance to pain improves and you feel better. But the most important thing that lies when it comes to piriformis syndrome are stretches and exercises. So piriformis syndrome requires stretching of piriformis muscle, but it's very important that if your pain is very severe, don't do the stretches. Only if your pain is bearable, at that time you do this. Till then, just avoid doing any stretches. Simple pelvic movements. So just now I said ultrasound and TENS, which is very helpful for your pain relief. So let me show you. So these are the devices which I was talking about. This is ultrasound and this is TENS. So for ultrasound, what we do is we mix Volini gel with, or else any kind of diclofenac gel with an ECG gel, and then we massage it over the area wherever there is a pain. Now these are the sound waves. Okay, so whenever these sound waves penetrate deep, they reflect from the bone. Whenever they reflect, they causes micro massaging, and the gel also penetrates deeper through this ultrasound waves, and thus helps in achieving inflammation reduction and pain relief. The next machine is this TENS machine. TENS machine basically works on desensitizing your pain carrying receptors and activating your normal pain reducing hormones in the body. That's where TENS is helpful. So TENS are small devices. It comes with some electrodes, some stickers and patches which you have to apply over the area of pain. So this also helps. Now apart from that, as I was talking about exercises, you should not do any stretching exercise unless it is tolerable, the pain is not very severe. Till that point, you should do normal range of motion exercise, especially around your pelvic region. Alright, so you can do simple exercise like forward and backward pelvic tilt. So let me show you that. So this is a simple forward and backward pelvic tilt. Similarly, you can do some hip hiking movements. So here what you are doing is you are causing a very small or minute movement without hurting much the piriformis muscle. Then you can do rotations of the spine. If you feel with leg together it's difficult, you can make your legs apart and then do it clockwise and then anti-clockwise. And then you can twist your pelvis and upper spine together. And you can do some gentle hip movements and down, down. But make sure not to do any aggravating or strong strengthening or stretching exercises. Now after that, once let's say your pain has come under control and it's okay for you to bear some pain, it's not that severe, that's when you can start your stretching exercise. The easiest way to stretch your piriformis muscle is just by sitting over any chair or else any high area like this, crossing the leg which is affected and then just leaning forward. So whenever you will lean forward, you will feel a stretch in your back of the hip region. You just need to hold it for 30 counts and then relax. 2, back, 3, 4 and 5 and relax. So simply by holding this for 30 counts and doing for 3 repetitions gradually helps you in reducing this pain. And the next thing, the most important thing again after this is your myofascial release massage or a simple gentle release, for which you can use a gun massager. So this is a gun massager which you can use to get some massage, deep friction massage over the piriformis area. You get many variety of this in marketplace, so you can choose one, whatever suits your purpose. So right now I'm just switching it on. It vibrates like this. All you need to do is just find that area where it hurts and place it there till the point you feel that good pressure massage. And you can dig deep and release, and thus it helps in achieving good level of muscle relaxation. This is something that you can do in also acute stage, but make sure that don't dig very deep, only do this at tolerance level. Again, as I mentioned in all my videos, this video is just for an educational purpose. So make sure to see a physiotherapist before starting any of this exercise program. I hope you found this video helpful. These were my top 5, and you can say some simple tips to get some fast relief from piriformis syndrome. I'll see you in another video. Thank you.